I'm not going to speak too much on the grant. That's another ideas I'll share with you. So, I want to tell you a little bit about myself, where I come from. So, I'm trained in pediatrics, and as a pediatrician, I took care of kids, and was trying to improve the health of the community one kid at a time. And from there, I had an opportunity to move into teaching full time, and I thought that'd be a good move for me because I had always hoped that I could somehow help create the next group of doctors who were caring, compassionate, evidence-based, and would treat people the way they need to be treated. And so I spent several years doing that and trying to turn out resident physicians trained in pediatrics the way I thought pediatricians should practice. And so I thought I was making probably a bigger impact because there's a whole lot of pediatricians in Fresno County now that I trained and I feel somewhat responsible for, the good ones and the bad ones. And so I think I accomplished what I wanted to do, but I started getting more interested in kind of broader perspective of community health, and that's when I started getting interested in actually public health research. I wasn't quite into public health yet, but public health research, looking at studying populations. And I did that for a few years, had some grant funding from the NIH, and worked with several universities, but that research really kind of got me more interested in trying, not just looking at data and creating data and hoping that it impacts policy, but actually taking the next step, which would be being involved in decision-making and policy-making. So I knew that I was pretty limited as a researcher in that, so I made the move to public health, and I joined the Fresno County Department of Public Health as the health officer in 2003. And I soon found that my opinion was valued. People were interested in knowing what I thought. But when it came down to it, the person who had the budgetary decisions, which basically decided what programs and services and strategies were really going to be implemented in Fresno County, was the director. And so 2 years later, I had an opportunity to serve as director, and I accepted the position, and I'm very glad I am, because I took that position because now, good and bad, I'm responsible for the budgets and the programs and policies that come out of the county's public health department. So that's where I'm at now. One more thing is I've been working at the local level, and I'm very happy to work within Fresno County as the Director of Public Health and Health Officer. But I've also been, in the last few years, working to expand our influence and working with and collaborating more, as has been discussed today. And so I've been working also at a regional level with all 8 San Joaquin Valley counties within the San Joaquin Valley Public Health Consortium. And VEVA's been a participant in that and a strong supporter of that as well. And I've also tried to impact public health at the state level. And so certain things I can accomplish here with all of you, and certain things I can't accomplish here for certain reasons that you are probably well aware of. But I can impact public health and policy at the state level. And so I joined, like I said, many of you have joined our Association of Health Officers and Public Health Directors, and at the state level, that's the California Council of Health Officers. And I was very fortunate to be nominated to serve as the president of that organization for a couple of years. And so I've been able, in the last few years, to be in a position to influence and affect public health policy through legislation, and also through implementation of bills and laws, through assisting in drafting regulations to implement a lot of the public health laws that have taken effect in the last few years. And so a lot of that I do is I can't do it just as the public health department alone. It has to be in collaboration with a lot of the nonprofits and the other public health organizations that we work with here in Fresno County, outside of Fresno County, regionally, and with partners who have public health expertise, like Public Health Institute, Prevention Institute, and others. So that's just background of my background. What I want to focus on is kind of what I heard earlier today, and that is when I first joined the department, a lot of our efforts were focused on preventing specific diseases. So there was asthma prevention, heart disease prevention, cancer prevention, dental disease prevention, and every program had certain strategies, and what happened, I think, is kind of fortunate for us. The one fortunate thing that came out of reduction in revenues, where I had to take budget reductions, was I had to really focus on what we can do to have the broadest impact. And what we did in our department was talking about organizational change and internal changes. We moved away. We didn't abandon, but we moved away from individual disease prevention to chronic disease prevention. And the reason was because there are certain strategies that our cancer prevention folks and our asthma prevention folks and our heart disease prevention folks were doing similar work. And we're doing similar work, and it's impacting and reducing the risk for different chronic diseases. What we decided to do was to focus on certain strategies that would have multiple impacts. So one strategy can have an impact on reducing risk for chronic disease for different chronic diseases. So when I and my staff are in public and talking in groups like this, we often are talking more about chronic disease prevention. So we're not talking about specifically obesity prevention, diabetes prevention, heart disease prevention. We're talking about chronic disease prevention. And in the last year, I also throw in preventing premature death. And that's because, as the presentation showed, here in Fresno County, working with the Fresno State, we did analysis of predictive life loss in Fresno County. And we were able to show that there are certain communities in Fresno County that basically the community as a whole is, the people in that community on average are living shorter lives than people in other communities here in Fresno County. And so I talk about chronic disease prevention and preventing premature death. So that's really my focus. And so a lot of the strategies that we have now, and you mentioned the CTG grant, a lot of stuff we're doing through the Community Transformation Grant, stuff we're doing through our USDA funded nutrition programs, they are geared towards going as far upstream as possible to find the strategies that we can implement that will have an impact on multiple chronic diseases and reduce the likelihood of premature death for Fresno County residents. So what I want to do is just give you an example of that. Something that hasn't really been talked about today, so a lot of stuff's been talked about today, so I'll pick something a little different. So we're right now we're in Fresno, City of Fresno. City of Fresno is in the middle and was built on an ag-based economy. And so one of the things that I'm doing is I'm recognizing that that's what Fresno is. And I'm not here to try to change Fresno. I'm here to look at where are Fresno's strengths, where does Fresno come from, what are its strengths, and what can we do to build on those strengths, and still fulfill what I'm trying to get as a public health official. One of the things that I recognize and we recognize is that improving nutrition will reduce risk from a variety of chronic diseases. And so how do we take advantage of our strengths here? Well, the ag community is an area that we're working on. We're working with a lot of partners. We're able to bring together a food system alliance. There are several in California now. We've had one now for almost 2 years. And this food system alliance is looking at trying to increase access or improve nutrition here in Fresno County. And we do that. We didn't start with a plan. Basically, agreed that we would come together to discuss this issue and understand from the farmer's perspective, from the producer's perspective, from the processor's perspective, from the people in the market who are consumers and buyers of food, and from the public health perspective. Is there a problem, and how do we address that problem? So that we all agree there is a problem. That the food that's grown here, a lot of it is processed into very unhealthy food, or is processed or shipped out and never comes back, or it's shipped out, processed, and come back at a higher price because of the transportation and processing outside the area. So we definitely recognize problems. So where we're at right now is that we are planning a food summit, and what the food summit intends to do is to look at, begin the conversation of how we change the food system, the food delivery system here in Fresno County, and not accept the way it is, but change the system itself with the buy-in of the producers and the consumers. And one of the things we're really going to have to focus on is things that we don't deal with much here in public health, but we have to find ways to address it, and that is just basically market demand. And how do we increase market demand? So that's something that I'm very interested in. I'm learning a lot, and fortunately we have many farmers involved. We have the ag And so so I'm giving that example of, that's an example of a couple things, and the result of a few things. One is the result of me making a decision to make some organizational change in the Department of Public Health to allow me to be in a better position to start moving in taking on new strategies. So this is an example of what can happen with organizational change. It's also example of policy change, and this would be both internal policy change, meaning we've made policies on how we're running our budget. So as a director, I can decide what's going to be, where we're going to spend our money, and we're going to spend our money on policy work, which we hadn't done much of, other than tobacco really hadn't done much of prior to that. And systems change. We've got people gathered around an issue that they agree upon, that there is a problem, and the only solution we're going to come up with is a solution that we come up with ourselves, and we all recognize that. And so I think on the spectrum of prevention, we're focusing particularly in some of the like 2 or 3 areas to tackle this. At the same time, we still need people. I've got staff here who are still working on education, nutrition education, because people still need to be aware, need to be educated, and they will need to make a choice. But on the policy and systems change, this is what we're doing is creating more healthy options for people to choose from. Particularly, and for some communities, there are no healthy options. So we'll create new healthy options that didn't exist before. So that's really the only example I want to give. I only had like 7 minutes, so we do a lot. By the way, we do a lot more in our public health department. We do a heck of a lot more, but this is just one example that I